In June of 2008, we interviewed one of Southern California's most respected neurologists, Dr. Ronald Ziman. He realized the potential of the Dashaway the first time he saw it. Since then, he has recommended and utilized the Dashaway to benefit both his own patients and his own family members. We were thankful to Dr. Ziman for giving us the opportunity to learn more about how the Dashaway can be used to help rehabilitate those suffering from chronic neurological conditions. We began our interview by asking if he has many patients with mobility problems.
Yes, I would say neurologists in general have a lot of patients with movement disorders and mobility problems of one sort or another that's inherent. In addition to those that have movement problems, you also have patients who may have balance problems, dizziness, prior strokes where they have difficulty using their legs or balancing or walking properly.
Do you find that your patients who do have mobility problems will notify you as soon as they feel this is an important issue?
Well, everyone with a mobility problem is different in terms of how they approach the physician or how open they are. But I would say in general, they don't tend to talk about it necessarily. Some patients will volunteer that information, or that may be the reason why they're coming to see you, because they're having problems with their gait or their balance. But then there are other patients who because they're proud, they're concerned that you might say that they need a walker or a wheelchair, that they don't want to necessarily make you aware that they're having walking problems.
And why do you think some patients are afraid to have a walker or wheelchair suggested to them?
Well, there's some patients, I think, that feel that there's a stigma that goes along with having a walker or being in a wheelchair. It represents a sense of loss of independence. And most people are very proud. They don't want to lose their independence. There's also a loss of pride that may go along with the fact that they are needing and dependent on having a walker or a wheelchair. So there are different reasons for different patients, but this is a concern, I would say, to many, many patients.
And how did you first find out about the Dashaway?
The first time I saw the Dashaway was at the annual American Parkinson's Disease Association walk. Prior to that, I had not seen one, and I'd never heard of the Dashaway.
And what did you think the first time you saw it?
Well, the first time I saw it, I thought to myself, that's a great idea. I wish I thought of it.
Once you discovered the Dashaway, did you think of any of your patients who might benefit from its use?
Well, since the Dashaway was being demonstrated and on display at the APDA walk, of course, I thought about its uses in Parkinson's disease patients and also its potential use in other kinds of patients. And I knew that there would be patients that are in my practice who would benefit from this device.
What do you think the main differences are between the Dashaway and other mobility devices on the market?
Well, the differences between the Dashaway and previously existing mobility products that I was aware of are severalfold. One is the engineering. It is what I call eloquently and elegantly engineered as far as a piece of equipment. And beyond the engineering, it really encourages the maintenance of proper posture and proper body mechanics, which the other mobility devices, at least that I'm aware of, don't necessarily encourage.
Have you ever seen another walking aid that doubles as a mobile exercise platform?
You know, the Dashaway, I think, is really unique in that it's not only a mobility device, but it is also a piece of exercise equipment that has a huge variety of exercises to improve balance, strength, flexibility, and posture.
So given the uniqueness of the Dashaway, would you classify it as a mobility aid or an exercise device?
Well, I think that the Dashaway actually functions as both a mobility device and an exercise device, and it is hard to differentiate the two, and I think that anyone who has a Dashaway would be most benefited by using it both as a mobility device and an exercise device. Now, some patients will have more mobility problems. Other patients may have issues with exercise that have to do with balance, that would limit them in terms of other pieces of exercise equipment, because the Dashaway allows you to exercise in the standing position as opposed to most other pieces of exercise equipment where you're seated or lying.
Do you see benefits for your patients doing their exercises in a standing position rather than sitting or lying down?
From my perspective, the advantage of being able to do exercises while standing as opposed to lying or sitting in this particular population is that they have issues with balance and walking to begin with. And so by doing exercises in those positions, in the standing position, they're reinforcing what is natural, and it reproduces what you want them to be doing in their everyday activities.
We like to think of the Dashaway as the first mobility device designed to make the patient better. Do you feel like the Dashaway can really help improve the overall health of the user?
The way I see the Dashaway and its use, at least in part, unlike other mobility devices, is that other mobility devices are designed to help you get from point A to point B, and that's where they end. The Dashaway allows you to get from point A to point B, but at the same time, it helps to rehabilitate you in terms of improving your strength, improving your posture, improving your body mechanics, so that you'll be able to do these things, activities more effectively.
Are there any specific types of medical conditions you would recommend the Dashaway for?
Well, the types of conditions that I would recommend the Dashaway for, aside from those patients who, say, have Parkinson's disease with difficulty walking, would include patients who have had other kinds of neurological injuries, such as spinal cord injury or stroke, where they need to regain their ability to stand and ability to walk while at the same time being supported and at the same time being rehabilitated. Patients who've had hip fractures or leg fractures would be another group of patients. Even patients who have had significant cardiac disease and are in a cardiac rehab program where they're working on their walking endurance and exercise endurance. The Dashaway is a way for them to work on those goals, not only in the rehab setting, but also back home.
Do you think that patients who are too weak to use a traditional mobility aid may be able to safely utilize the Dashaway?
Yeah, I think the way the Dashaway is engineered and the way it's designed, patients who would otherwise be too weak to use a normal type of walker, a traditional walker, as we would think of it, would many times be able to tolerate being upright and utilizing the Dashaway.
Do you think the Dashaway will be helpful to people with osteoarthritis?
Patients who have osteoarthritis, especially involving the spine or the hips, knees, or ankles, would benefit from the Dashaway because its design is such that it reduces the pressure that's put on the spine and the various joints, allowing the person who's utilizing the Dashaway to be able to walk and exercise without stressing the joints to the same degree as they would otherwise.